Hi, I'm Dr. Leigh, and in today's episode I'm going to be talking all about kennel cough. You're going to learn about how to recognise the cough, how to prevent it, and what causes it, and most importantly, how to treat it. So make sure you listen right to the very end when I'm going to go over how you can treat it and provide a link for you to download some measures that you can do at home yourself. As always, if you like this video, make sure you give us a thumbs up. You gonna give us a thumbs up? Yeah! And subscribe to our channel. So, numerous organisms may be involved with the case of kennel cough. Bordetella bronchoseptica is one of the main bacteria that causes kennel cough, and as well there are a multitude of viruses. I want you to take a listen to these dogs in these videos that I've got here for you, and you're going to be able to recognise exactly what the sound of a kennel cough actually sounds like. So most dogs actually, luckily, remain really active and have a normal appetite even though they are having these massive coughing fits. However, in some animals and in some cases, it does have the potential to become much more serious. If you notice that your dog has trouble breathing or is bringing up phlegm and has stopped eating, I really do urge you to seek medical or veterinary attention. Okay, the prevention of kennel cough. Bordetella is a fairly contagious pathogen, and lucky for us, we do have a vaccine available that does provide some protection. The standard injectable vaccine covers all pathogens in the kennel cough complex, and it's a good option for puppies as long as they are given 2 doses about a month apart from the age of 4 months old. Boosters are then given annually. There's a nasal vaccine that can be given as early as 3 weeks of age, and this has the advantage over the injectable in that it stimulates local immunity in the nasopharynx area. So that's exactly where a natural infection would likely take hold. So in this case, the nasal vaccine generally provides faster immunity than the injectable, and it takes only about 4 days to generate a really solid immune response. Bordetella is a fairly contagious pathogen, and the amount of stress an animal has in its environment can affect the likelihood of contamination. Infection can be quite common when there are groups of animals together in contact. So this can mean anything from a vet clinic visit, kennels, shelters, parks, groomers and classes where there might be a warm environment, and of course all those animals are in close contact. If you are planning on boarding your dog for more than and it hasn't had a vaccination for more than 6 months, I really do recommend that you give them a booster, and this needs to be given at least 5 days before they go into the boarding facility so that their immune system is stimulated. I also want to remind you that it's worthwhile remembering that just like a human flu vaccine, the kennel cough vaccination doesn't provide 100% protection, and that means that some dogs might get a lesser case of the disease. Right, what everyone's waiting for, and that's how do we treat kennel cough? The latest recommendations for the treatment of kennel cough actually involve a 10-day observation period for those dogs that have very mild clinical signs. So they have a normal appetite and attitude. So basically what this means is that we don't use any medications such as antibiotics during this period. And as most cases of kennel cough actually resolve on their own, so often no treatment is required. Antibiotics should only be considered if your dog has a really heavy mucopurulent nasal discharge or a cough that's producing phlegm, or they've got a fever, or they're not eating any food. In these situations, your vet will likely prescribe an antibiotic called doxycycline for about 7 to 10 days. And this is a first-line antibiotic, and it covers most of the things that potentially could be causing the problem. In those situations where your dog is actually coughing so much that it's distressing to not only them but to you, your vet may also prescribe codeine to suppress the cough. Now, I want you to be really aware that there are some codeine syrups that contain xylitol, and this is highly poisonous for our dogs. So please double check and always ask your veterinarian. Alright then, for those in-home treatment options, I want you to click the link below and download the PDF, and they have all the tips for treatment that you can give your dog to make life a little bit easier in that 10-day observation period. I also want you to remind you that the incubation period for kennel cough is anywhere from 2 to 14 days. So that means if your dog has come in contact with a dog that's been shedding, you might then see them become sick 2 to 14 days later. And again, most dogs are sick for about 2 to 14 days, but the worst part is that they can actually continue shedding the kennel cough organisms for up to 2 to 3 months following infection. So this means that if your dog gets kennel cough, it's important that you don't mix with other dogs for 2 to 3 months after they recover. Yep, that's sad times ahead, I'm afraid. If you enjoyed this video, make sure you give us a thumbs up, subscribe to our channel so you don't miss any of our top tips. Mordecai and I say bye for now.